Hello, my dear students. So, in series of 30 most important pharmacology questions for your Jan 2024 exam, I have chosen second topic as a treatment of HIV. So, this topic is also asked in your last exam. So, according to me, this question or this topic is important for your upcoming exam also. So, if we talk about treatment of HIV, so in this treatment of HIV, we give combination of three medicines together. So, this treatment of HIV is applicable to both pregnant as well as non-pregnant patients. So whether the patient is pregnant or not pregnant, and non-pregnant patient can be an adult patient, old patients or adolescent patient, young patients. This treatment is same for everyone. So in this treatment of HIV, we give three medicines together. And which three medicines we give in combination? We give a combination of medicines like tenofovir. We give a combination of drugs like tenofovir. We have a medicine like lamivudine. So we have a medicine that is lamivudine, and the third medicine is dolutegravir. So this combination, that is T plus L plus D, this is a fixed dose combination. FDC means fixed dose combination. So patient is supposed to take one tablet on daily basis. So patient will take one tablet on daily basis at night time. So patient will take one tablet on daily basis at night time. This is a combination of tenofovir, lamivudine and dolutegravir. If we flip the sequence of this medicines, then I will say the medicines names you can remember with the word DLT. And if you can remember like this way, we can delete HIV from our life by taking the medicines which is DLT. So DLT you can remember with the mnemonic, that is DLT, delete HIV, after taking these three medicines together. Now these medicines can be taken lifelong, right? So treatment is given lifelong. It's a long-term treatment that is given to a HIV positive patient. Now, this treatment is given to all HIV positive patients. This is irrespective of CD4 count. So, irrespective of CD4 count, this treatment is given to all HIV positive patients. So, whosoever is found to be HIV positive should be on this treatment of D plus L plus D, and this treatment can be given lifelong. The second question which they can ask you is the prophylaxis. So we have a post-exposure prophylaxis. So whenever any normal healthy human being get exposed to some HIV positive patient, like you as a doctor, when you get exposed to some HIV positive patient while doing the sampling, or maybe you have a splash of blood while doing the surgery, so you can have the exposure to this HIV positive patient. Right? This is post-exposure prophylaxis that you people require. So post-exposure prophylaxis, again we give combination of three medicine, that is D plus L plus D. So again three medicines are given, but now this combination is given only for 28 days. So this combination is given only for 28 days, and this treatment should be started. This treatment should be started within 2 hours. So this treatment should be started within 2 hours of the exposure. Maximum we can start this treatment up till 72 hours. So maximum we can start the treatment up to 72 hours, but best to start within 2 hours of the exposure to the HIV positive patient. But the treatment is taken total for 28 days. Right? So once the patient is HIV positive, he requires treatment lifelong. But when you get exposed, or any person get exposed to HIV positive patient, he is yet to acquire the infection. So he can prevent the multiplication of the infection in his body by taking the same combination for 28 days. Now, third is vertical transmission. So whenever any female will deliver a baby, so there is a risk that infection which is present in the mother can be transferred to baby. We call it vertical transmission. So if we want to stop this vertical transmission, so any mother who is HIV positive, so any mother who is HIV positive, and you want to prevent the spread of the infection to the babies, so what you can do, so that depends whether the mother is on antiretroviral therapy or she is not on antiretroviral therapy, whether she is taking antiretroviral therapy or she is not taking antiretroviral therapy, right? So if she is taking antiretroviral therapy, apart from that, there is one more criteria. You can also check the virus RNA copies. You can also check the virus RNA copies. So viral RNA copies are less than 1000, or viral RNA copies are more than 1000. So if she is taking antiretroviral therapy and the virus load is less, now here the infection risk going to the baby through the blood is very low. So baby is at low risk of getting the infection. So this baby immediately after birth require only one medicine for 6 weeks, and that medicine is nevirapine. So nevirapine is a name of a drug. This medicine the baby can take for 6 weeks. So nevirapine can be taken for 6 weeks in case the mother is on antiretroviral therapy and the virus RNA load is less than 1000 per cubic millimeter. Right? Now, in case nevirapine is not given in MCQ, you can mark zidovudine. So zidovudine is a second drug as an alternative of nevirapine in case you are not comfortable in giving nevirapine or baby is getting the side effect like hepatotoxicity, so zidovudine can be given for 6 weeks. But if the mother is not taking antiretroviral therapy and the virus load is also very high, the baby is at high risk of getting the infection. When the baby is at high risk of getting the infection, now this baby requires two medicines together. So we'll give a combination of nevirapine plus zidovudine. So nevirapine plus zidovudine combination is given, and this combination is given for 6 to 12 weeks. That depends on the breastfeeding. So two medicines are given together. Now, if the baby is on exclusive breastfeeding, so here EBF stands for exclusive breastfeeding. So the baby is on exclusive breastfeeding. Now, again, the risk of transferring of the infection is high. So on one side, the baby has acquired more infection through the blood during the time of delivery. Now, if you start exclusive breastfeeding, the risk is going to be further increased. Now, this treatment can be given for 12 weeks. So here the treatment is given for 12 weeks. If the baby is not on exclusive breastfeeding, baby is on mixed type of feeding, baby is also having the top feeding in between. Now, the risk is comparatively low. Now, this baby requires two medicines together for 6 weeks only. So exclusive breastfeeding not there, baby required treatment for 6 weeks. Exclusive breastfeeding is there, baby required treatment for 12 weeks. So this is the treatment for HIV that you should be knowing for your exam. At the end of this topic, I want to give you a bonus tip. So if we talk about the medicines that are given for the treatment of HIV, so the medicines which are given for the treatment of HIV, so guys, we can divide these medicines grossly in four groups. So medicines are known as enzyme inhibitors. So medicines are known as enzyme inhibitors. We can divide these medicines grossly in four groups. The first group of medicines are known as nucleoside reverse transcriptase inhibitors. So we call them NRTIs, that is nucleoside reverse transcriptase inhibitor. And most of these medicines end with the word vodine. Most of these medicines end with the word vodine. Like above, we have discussed this medicine, lamivudine. So lamivudine is an example of NRTI. But of course, we have some different names. For example, we have discussed one drug above, tenofovir, that also belongs to the same class as NRTI. The second class of medicines are known as non-nucleoside reverse transcriptase inhibitor. So we have a nucleoside reverse transcriptase inhibitor. We have a non-nucleoside reverse transcriptase inhibitor. Now here, the most of the medicines end with the word virin. Most of the medicines end with the word virin, but again, we have few medicines which are different. For example, nevirapine we have discussed above. This medicine also belongs to the same class as NNRTIs. Now we have a third medicine also. The third group of medicines are known as integrase enzyme inhibitor. So I have written as II, that is a integrase enzyme inhibitor. Now all these medicines end with the word tigrevir. So you can find out the word tigrevir. They have the integrase enzyme inhibitor. So tigre means integrase enzyme inhibitor of the virus. So these medicines are end with the word tigrevir. Now here we have an example that we discussed above. The drug name is dolutegravir. So dolutegravir is a medicine which is a type of integrase inhibitor. The last group of medicines are known as protease inhibitors. We have one more enzyme inhibitor, we call them protease inhibitor, and all these medicines end with the word navir. So all medicines which end with the word navir are protease inhibitor. One classical example of the drug is ritonavir. So ritonavir is the drug which is considered as protease inhibitor. Right? Now guys, this is all about the special bonus tip. Here it is a question for you that you have to answer in a comment box. We have discussed one drug above, zidovudine. So zidovudine we have discussed above. It's a one of the drug that can prevent the vertical transmission from mother to fetus, mother to newborn. Now here you have to answer me that zidovudine belongs to which class. Right? So in case you have already found the answer, please answer this question in the comment box. And also if you like this video, please subscribe to the channel and share with your friends. Thanks for watching this video.